Anabolic androgenic steroids. The psychological effects. Dr. Brown-Séquard was a famous physician and a professor at Harvard, famous for performing experiments on his own body. The doctor discovered testosterone, which was dubbed the elixir of life by his colleagues. There is no need of describing at length the great effects produced on the organisation of man by castration, when it is made before the adult age. It is particularly well known that eunuchs are characterised by their general debility and their lack of intellectual and physical activity. Séquard also believed the release of spermatic fluid led to a general decline in physical and mental abilities. Séquard correlated strength and vitality to this fluid, and guessed that the loss of vitality in old age must be due to a loss of some mysterious material created in the testicles of men. Since Séquard used his own body for research, he took a mortar and pestle and tried to extract various fluid types from the testicles of dogs and guinea pigs. At the age of 72, he was beginning to feel the effects of old age. After proving the effect of the elixir on his elderly rabbits and dogs, Séquard prepared himself for the experiment. I have made use in subcutaneous injections of a liquid containing very small quantity of water mixed with 3 of the following parts. First, blood of the testicular veins, secondly, semen, and thirdly, juice extracted from a testicle, crushed immediately after it had been taken from a dog or guinea pig. The testing of testosterone would finish with Dr. Brown-Séquard until the 20th century, that the idea of male chemical causing vitality was revived. The stockyards of Chicago provided an enormous amount of animal material for experimentation, and Fred Koch at the University of Chicago put the animals to use. Koch obtained 40 pounds of bull's testicles and managed to extract 20 milligrams of pure substance from the material. In the 1930s, the world was engaged in full-scale research on the hormone, now known to be a steroid. In 1935, the first attempts to synthesize testosterone from cholesterol were made. By 1939, the Nobel Prize was issued to Butenandt and Ruzicka for the discovery of how to synthesize testosterone from cholesterol. This ushered the golden age of steroid chemistry, which lasted throughout the 1950s. In Nazi Germany, it is widely believed that anabolic steroids, derived from testosterone, were administered to German soldiers to increase aggressiveness. There are some reports that Adolf Hitler administered injections of testosterone to himself. The Soviet Union noted the increase in physical strength, aggression, and endurance gained by the German army via the use of steroids, and began experimenting with the steroids in the 1950s. It is quite possible the Soviets used anabolic steroids during the 1952 Olympic Games. In 1967, a ban on the use of anabolic steroids was announced by the International Olympic Council. By the 1970s, most major national sports followed suit and implemented a ban on the use of steroids to improve athletic performance. The harmful effects and side effects of steroids are many and numerous and well documented, and over the years have been shown in a negative light due to their abuse and connection to cheating in sport. Conditions like shrinkage of the testicles, kidney stones, cancer, irreversible liver damage, abnormal sperm decrease count, it's shown to impair bone growth leading to shorter height, and muscle tears due to the muscles getting stronger than the tendons and tearing more easily. Cancer, stroke, and many mood changes are also one of the effects of the many effects. Psychological, aggressive behavior, anxiety, paranoia, depression, mood changes and sleep disruption, addiction and withdrawal. Although there are many negative side effects to steroid use, there is a clinical position for them and have been used to treat a host of conditions, including the following: many forms of anemia, acute and chronic wounds, protein calorie malnutrition with associated weight loss, severe burns, short stature, osteoporosis, primary or secondary hypogonadism, prolonged catabolic state secondary to long-term use of corticosteroids, human immunodeficiency virus or HOV wasting syndrome. The psychological effects of steroid use have been shown to be aggressive behaviour, anxiety, paranoia, depression, mood changes, sleep disruption, addiction, and withdrawal. Aggression and hostility, otherwise known as roid rage, was the first study of the effects of steroid use among athletes. Like many studies since then, it relied on self-reporting. Some users of AAS showed to have an increase in aggression, yet one study showed lower hostility amongst users. Depression and anxiety, or effect on the mood of anabolic steroid users, is inconclusive at best. Some research shows increases in depression, anxiety, and paranoia, yet some studies show AAS may decrease mood symptoms. Mood seems to be more affected by withdrawal and dependency more than use. It is shown that 30% of users go on to be chronically dependent on steroids. Other factors which may affect depression, anxiety, paranoia may be the length of use and the dosages used. One of the biggest issues psychologically is the body image issue. First of all, known as reverse anorexia or bigorexia, which is now known as. Are people who suffer from muscle dysmorphia predisposed to psychological disorders before AAS are introduced, or does the use of steroids cause these adverse effects? Although there are many negative side effects from AAS use, we rarely read about the positive effects because of their damaged reputation. Increased facial hair, deepening of the voice, increase of sex drive and ambition gives the male the alpha male traits, which in turn improves overall confidence. Studies have shown that even in studies where placebos are used, the placebo effect can cause increasing confidence. Anabolic androgenic steroids may exert profound psychological effects. However, only a small number of users may be affected. Increased hostility and aggression appear to be the most prominent of those who suffer. The Adonis complex, and those who suffer the Adonis complex and show narcissistic traits are more susceptible to developing anabolic steroid dependency, as are those who suffer muscle dysmorphia.